Hello, my name is Sydney Carter, and this is my change project proposal. I'm first going to start out by discussing the issue at hand, which I chose from my facility at my pediatrician's office that I work part-time at in Madison, Alabama. And the clinical problem that I chose and that I wish that we can improve is proper patient care etiquette from staff, whether that be the tech, anyone who is directing things towards the patient or towards since it's a pediatrician's office, the parent. Just making sure we're ensuring that patient care etiquette and we're constantly improving that. Once we do improve this, the efficiency, the effectiveness, and financially, we will be improving overall. Improving proper patient care etiquette by holding annual training sessions would make the facility more efficient for management and staff, not having to come back and reiterate issues. This is a big thing that we have had trouble with, is that we will hold a training session 2 years ago, but whenever we hire someone new, they're being trained by someone seasoned. So it's a lot less likely for that person being trained to really understand the efficiency and the effectiveness of this issue in order to apply that to their everyday. An ethical policy or legal concern is that in the article from the National Library of Medicine, I quoted this, that Kahn suggested that the practice of etiquette-based medicine, simply treating the patient courteously, may lay the groundwork for therapeutic physician-patient relationships. And I think this is so vital in understanding that when we are working towards the goal of proper patient care etiquette, that this not only benefits the healthcare worker, but it also benefits the patient, of course. And we want to make sure that we're ensuring that and we're drawing attention to that every single day with every single patient. I have completed a general stakeholder analysis of those who would be involved. I have it listed somewhere a little bit farther down in the slides of a map that I made. The persons that I would be involved is the seasoned nurses, and that means just people that have been working there for a long while, or even just the nurses that have been working at the facility for a long time, and the doctors. I believe this because doing something one way for so long, even if it is not the right way to do it, can be hard to give up, which I have experienced this, and some of the people that I've phoned a friend in this project have experienced this too. This is my stakeholder mapping, and I think this just gave us such a perfect example of what being and recognizing what stakeholders are in your facility whenever you're trying to improve a system or just a problem in general. I kind of written out here this keep satisfied, manage closely, monitor, keep informed. All of this right here is very important to recognize because I have different boxes filled with different, I wouldn't say really organizations, but different people that really need to be under these categories. That way when we're planning out a problem to fix, that way we recognize each other's positions. So this is actually a cause and effect diagram. I'm a big visual person, so the first little centerpiece here is decide to conduct training sessions annually to prevent. And this is meaning just to prevent the incorrect way to care for patients. And I think that it's important to first what we notice the issue in the facility, and that these all branch out to different things. And I like that you can see, well, if I decide to do this, then it's going to lead to that. I just think this is a good example of what a process that we can use in order to really think out the process of changing this issue. This is just a list of some brainstorm ideas that us and these women had, and it was just basically kind of just writing out the practical steps, and which I'll just read them off, which is first the assessment, which is conduct surveys and focus groups to understand the current state of patient etiquette. I think this is very important because most people, whenever you're training them, you're just already assuming that they know what we're talking about. And sometimes we run into people that don't, and that's okay. We need to make sure that we're reiterating things, even if it makes us feel silly, but we need to be explaining things in training over the top more so. Training, which is inevitable, develop and deliver training programs focusing on communication skills, empathy, and patient-centered care. Policies, establish clear guidelines and protocols for patient interactions. I think the main word to highlight here is clear. I think it's important that we don't have any gray area in training in these training sessions. Also, feedback mechanisms, create a system for patients and staff to provide ongoing feedback on etiquette practices. I think this is very important because how can we know as a facility that we're improving without feedback? Recognition, implement a recognition program for staff who consistently demonstrates excellent patient etiquette. I think it's always good to make sure that we're highlighting and we are kind of giving a pat on the back, just to say that, to staff members that are excelling and that are really showing their knowledge in this. Monitoring, regularly review patient feedback and staff performance to ensure sustained improvements. I think this is very important. I think that once we get down to like recognition, it can get kind of a little bit gray, like I was saying earlier, because we're doing everything we're supposed to be doing. We are getting good feedback, and then a couple years go by, and it starts kind of this cycle again of people doing their own thing and not really wanting to do it the facility's way. But I think this is a problem that we're experiencing right now at our facility, is that we've just kind of slacked off management wise in making sure that we're monitoring the upkeep of patient care etiquette. Here's my SMART objective. There's specific, measurable, and achievable, relevant, and time-bound measurable goals. But mainly I want to point out my main SMART goal, which is by December 31st, 2024, implementing a comprehensive communication training program for all nursing staff, establish bedside shift reports, and conduct regular patient care rounds. These interventions aim to increase patient satisfaction scores related to nurse-patient communication by 20% and reduce patient complaints about staff interactions by 30%. Here's my force field analysis. The first part is about how I will deal with resistance. I'm going to first engage stakeholders early. I'm going to use clear communication, provide support and training, address concerns, and recognize and reward compliance. I think this is a kind of a reiteration of what was mentioned earlier when we're talking about the introduction of the issue. And just to go along to the other side, this is what I will be doing just to implement, which is highlight benefits, emphasize the positive outcomes for both patients and staff, role models, use respected staff members to champion the change, incentives, which is very important that we all kind of curated together, which is provide incentives such as recognition, awards, or small rewards for early adopters, and for continuous feedback. As you can tell, feedback is very important whenever you're trying to learn new things and teach new things to staff members. So this is the Lewin's change theory that I use, just a little template, the unfreeze, change, refreeze, which the assessment, just conduct an assessment to understand the current state of the patient care etiquette, which we have already done. And then the communication is key, in order to revising this issue. Involving stakeholders is one way that you can reduce some sort of negative feedback because you're involving them from the very first part of this change. The change part, training programs, bedside shift reports, patient care rounds, feedback mechanisms. This change part seems kind of repetitive, but it is very important because this is the meat in the sandwich. This is where all of this starts to come into play. And then the refreeze, which I like, is institutionalized practices, which is meaning ensuring that they are institutionalized and that everyone knows them and that they're in their daily routines and protocols. Monitoring and adjusting. I like how we use the word adjust in this because we're going to be monitoring, but sometimes we might monitor something and we're like, well, maybe I actually have a better idea for this. So we're going to continuously monitor the effectiveness of the changes and make adjustments as necessary. Reinforcement. Very important, providing ongoing reinforcement through regular training. I just want to kind of look over the implementation plan, which is to hold training sessions, to role play by using online modules, to have kickoff meetings, to have regular feedback sessions, to potentially have some internal campaigns, maybe some posters, emails, and newsletters, and recognize people and implement recognition programs towards staff who consistently demonstrate excellent patient care etiquette.